You chose absolutely right tuning in to Rwanda Television. A very good evening to you and many thanks for joining us on our tonight's edition. A sneak peek to it, these are the headlines. President Paul Kagame told members of the newly sworn-in cabinet to conduct regular self-evaluations which could inform them of areas of improvement. Citizens across the country believe that during the next 5-year term, local leaders should avoid delaying service delivery. And to international matters, Blinken renews Gaza ceasefire efforts, but implementation may be challenging, analysts say. Good evening to you once again, and thank you for your company on Rwanda Television News. And as we kick it off on local matters, the President of the Republic of Rwanda, His Excellency Paul Kagame, on Monday told members of the newly sworn-in cabinet to conduct regular self-evaluations, which will inform them of areas of improvement as they fulfill their responsibilities in government. Adam Squizera starts us off tonight.
Jewe Murangwa Yusuf.
Jewe Nduhungirehe Olivier.
Earlier today, President Paul Kagame presided over the swearing-in ceremony for the newly appointed cabinet members, which included 21 ministers and 9 ministers of state. Dr. Doris Picard Uwicheza also took the oath of office for her new role as the Chief Executive Officer of the Rwanda Governance Board, RGB. In his address to the newly sworn-in cabinet, President Paul Kagame emphasized that this new term should focus on building upon past achievements while also evaluating performance to correct any previous mistakes.
Every time when there is a change like this, switching from one mandate to another, I even stressed this last time in Parliament when we were receiving the oath of deputies. That's not just switching on and off. That's why, in my perspective, if there is something we did last time and went well or something that went wrong, we should put all that together and evaluate it to measure what we are going to do and how, so that we can work effectively.
President of the Republic Paul Kagame also told members of the newly sworn-in cabinet to conduct regular self-evaluations, which will inform them areas of improvement as they fulfill their responsibilities in the government.
You should use what you have within yourselves to fulfill the responsibilities you have just taken an oath for. These are responsibilities to serve Rwandans, including yourselves, except that you should not start with yourselves. When you are serving Rwandans, even though you are included, you shouldn't prioritize yourself. However, that doesn't mean that you should ignore yourself, that you are working for others, not finding the interest you have in that.
President Paul Kagame also pointed out that despite the significant progress Rwanda has made in governance and overall development, there is no room for complacency. He urged the newly appointed cabinet members to remain vigilant and committed to pushing the country forward, highlighting that the journey towards sustainable development and good governance is ongoing and requires continuous efforts.
If the country is performing well, and its officials as well, it's not the time for complacency or to fall from the progress people appreciated, or to step back due to losing focus. We should ask ourselves, if we achieved that, can't we achieve even more?
President Kagame also urged the newly elected officials to work together as a unified pillar in governance, emphasizing that their efforts should be rooted in the development and well-being of the citizens.
First, in these responsibilities that all of us carry for our nation, the country cannot move forward based on one person only. It cannot happen. One person who has done very well devoted himself or herself to everything is not enough. That one person alone cannot get us anywhere, or will not get us where we want to be as a nation, because no one works alone, no one lives alone. Institutions must work together. When I say institutions, I mean people. People must work together. Institutions must work together. Our national institutions must complement each other to spearhead our economic transformation journey. There is no shortcut.
The head of state also reiterated that Rwanda cannot develop if people work in isolation, meaning that all levels of leadership should work together and deliver on their duties on time. Among those who sworn in this Monday, 3 of them are the new faces in the government, including Sebahizi Prudence, the Minister of Trade and Industry, Ambassador Christine Murikinga, the Minister of Public Service and Labour, and Richard Nyirishema, the Minister of Sports. Adam Squizera, RwandaTV News.
Thank you, Adams. And still on this, the cabinet members who took their oath on Monday have committed themselves to fulfilling their responsibilities in their respective institutions. They were speaking to our colleague Paul Rutikanga.
I want to start by thanking His Excellency the President for the trust. I've been working in different positions for the government, but now I'm reaching another level. And the trust he put on me, I commit not to disappoint him. I will do all the best and to my best of abilities to deliver. Of course, it's exciting. It's an exciting moment when you're sworn, taking the oath on the Rwandan flag. It's a strong commitment we do. So that one also is exciting, but it's also exciting now to look at the task ahead. Where do we start? What do we start with? It's a completely new portfolio for me, but I'm really excited to work on it with all my colleagues.
And ready, of course, to...
Absolutely, I'm ready, yes.
Any area of priority maybe?
Priority, I cannot now, not yet, because I've not yet taken over the ministry, but from the outside, this job creation, employment, yes, from the outside. So we will have the session to have the handover with the team tomorrow, and then we will see what are the priorities, and of course, under the leadership of His Excellency.
I'm very, very happy and very excited to take on this new challenge, and incredibly honored and privileged to be here swearing in. It's a very solemn moment that to have been entrusted with these new responsibilities.
And is there like an area of priority that you're going to start with?
I think right now it's to focus on the core mandate of RGB and the pillars of governance. I come from a background of the rule of law, so obviously that will be something that I will look into, but I want to look into all the programs that are existing and build on what has been achieved. As you know, His Excellency just said that we must never be too comfortable, we must always strive for more.
And moving ahead, citizens across the country believe that during the next 5-year term, leaders should avoid delaying service delivery and instead focus on addressing the problems that hinder their progress. Uwamwezi Marie Rose is the Executive Secretary of Kanzenza Cell in the Nyamata sector of Bugesera district. We found her in the office, actively addressing community issues. She takes the time to understand each individual's problem and works on finding solutions.
Pregnant mothers should always consult community health workers so that they can be helped. You should always remember that, just as you always do when your children are sick.
Residents applaud the service they received.
When I got here, they served me well. I was clearing the health insurance. Even others who came before me were served well. In our area, I have never heard of cases related to delays in service delivery.
However, citizens in different parts of the country have consistently expressed dissatisfaction with the services provided by the local leaders, which hampers their progress.
It leads to poverty that affects family. For people who survive on daily labors, they might be tempted to acquire things illegally. In the end, this affects citizens and the country.
From this, they believe that during the next 5-year term, local leaders should avoid delaying service delivery and instead focus on addressing their problems.
Leaders should get out of their offices and come to citizens down to the local levels. That is what decentralization means. Leaders are appointed to address issues affecting citizens, not to stay up there in the offices.
The Deputy CEO of the Rwanda Governance Board, Dr. Félicien Usengumukiza, reiterates that when citizens are not satisfied, it affects other pillars of the country's development.
Putting citizens up front and making them the priority is what we have to do as leaders, enhancing principles and policies for their development, where citizens have a say in activities meant for them, is what leaders should do. Because unlike before, citizens are not just beneficiaries, but also partners with the leadership.
President Paul Kagame has indicated that the next 5-year term should focus on addressing issues affecting citizens and has urged leaders to fulfill their responsibilities.
Leaders should not be appointed to positions so that can prioritize themselves or the beneficiaries of our work to start with us leaders. That's not right. Yes, we should get the benefit as people, but we should think about Rwandans first, the citizens of this country. Sometimes we find that the issue of the entitlement that comes with appointments keep recurring. In foreign languages, they call it VIP or VVIP. You simply mistreat a person because you are VIP. All the little resources of the country are diverted to first solve the problems of VIPs.
Service delivery by local authorities is one of the lowest scoring areas, according to various Rwanda Governance Scorecard reports released by the Rwanda Governance Board. According to the statistics from the National Child Development Agency, 22% of the children in Rwanda lack access to early childhood services due to a parent's understanding. These were demonstrated on Monday in a 3-day conference on early childhood development. Prince Manzi brings us the details.
Numbers of children accessing ECD services grew from 17% in 2016 to 78% currently. This means that 22% of children lack these services, as elaborated by Gilbert Munyemana, the Deputy Director General of the National Child Development Agency, NCDA.
Access to ECD, like in 2016, we were having 17% of children only accessing through primary schools, but now with the new policy which gives more types, like in the community, in the home-based, we have reached 78%. 78%, we still have 22% that needs also to have access to ECD services. So that's one of the gaps which we are working with the local government to ensure that actually we have universal access to ECD, and that's actually have been included also in the Mihigo, the performance contracts, so that in the few coming years we don't have that challenge anymore.
In this conference, they are analyzing how the gap in ECD access can be enclosed. These are the suggestions of some of the partners.
The issue mostly is the mindset, because ECDs are there, trainers are there, and collaboration is key, and also the understanding to change mostly if we emphasize on the awareness.
Gap is mostly found in the rural areas, and there's also lack of partners in these regions. So it is possible to address this gap, but if we emphasize on the rural areas where they have an against mentality and where parents are not understanding the importance of ECDs.
To enclose this gap, Rwandans are to make this program theirs. We set the responsibility to increase awareness, and if they make it their responsibility as Rwandans, they will also figure out solutions.
The permanent secretary at the Ministry of Gender and Family Promotion, Mireille Batamuriza, reiterates that if various sectors understand the importance of the ECDs, the gap will easily be enclosed.
But
as we see that partners understand this, so are other levels. So this contributes to the increase in quality development.
More than 1 million children under the age of 6 are currently reached by the Early Childhood Development Services in Rwanda.
And to health matters, the Ministry of Health highlights that the recent upgrade of several hospitals to level 2 teaching facilities is a strategic move to boost the number of medical services providers, which is still low. Additionally, this upgrade provides students in medical sector with facilities where they can complete internships. The initiative aligns with the broader plan to expand hospital infrastructure across the country, aimed at strengthening the overall health sector. Olive Nete brings us the report.
To be upgraded from a general hospital to a teaching hospital, several key requirements must be met. These include the hospital's structural capacity, the necessary infrastructure to accommodate students for hands-on learning during internships, qualified trainers to guide them during clinical attachments, and adequate material to support their studies, among other criteria. Interns at these teaching hospitals include students in general medicine, general nursing, and those training to become specialists in specific areas of medicine, who are called residents. Dr. Menelas Nyeshimana, head of the Department of Health Workforce Development at the Ministry of Health, emphasizes that clinical attachments are crucial as they equip future medical professionals with the essential skills needed to treat patients effectively.
If you look at countries that have successfully been able to meet the health workforce required for their own needs within the country, you cannot train in the same sites only. At some point you have to think about expanding your teaching site and accompany other hospitals to meet the requirements. So it's in that framework that level 2 teaching hospital were facilitated in terms of structure, staffing, infrastructure, equipment, making sure that the leadership understand the responsibility and accept the responsibility, and you make sure that they are able to actually implement the teaching component. They are of that caliber to be qualified as educator. And that's how from the level 1 teaching hospital, the usual hospitals, Chub, which had
during clinical attachments or placements, students receive close supervision and guidance to ensure they acquire the necessary knowledge and skills. Dr. Emmanuel Rusingiza, Director of Clinical Education at the University Teaching Hospital of Kigali, emphasizes the importance of this support, highlighting how students are thoroughly assisted throughout their internships to enhance their learning experience.
So usually in the hospital, much of the focus is done on the learning from the patients. But the department knows also that it has to consider some of the important topics that it will present or prepare to teach those students. So most of the times there are morning meetings when they present cases that they have had, either during the night or a specific case to discuss in the ward. And then afterwards they go for ward rounds, but usually in the afternoon there are sessions of tutorials.
The Rwanda Military Hospital, King Faisal Hospital, the Ndera Neuropsychiatric Hospital, the University Teaching Hospital of Butare, and the University Teaching Hospital of Kigali have traditionally been the primary institutions providing internships for medical students. Recently, 10 more hospitals have been upgraded to level 2 teaching hospitals, expanding the opportunities for medical training based on their capacities. Among these newly added hospitals is Sibagabaga Hospital. The Director General of this hospital, Lieutenant Colonel Dr. Munyemana Ernest, notes that upgrading the hospital from a district level to a university teaching hospital has significantly enhanced the hospital's capacity in various areas.
Currently, we have 4 resident students in gynecology and obstetrics who will spend 1 year at this hospital. They receive daily lectures and follow-ups, which greatly benefit our team. Our midwives, nurses, and general practitioners can learn from these residents, enhancing their skills. Being upgraded to Level 2 Teaching Hospital has significantly increased our capacity and performance. This upgrade also ensures that we have a steady presence of doctors who serve the large number of patients we receive. Additionally, we have benefited from receiving new equipment.
The addition of these Level 2 teaching hospitals will alleviate the burden on existing hospitals that have been accommodating medical students. Previously, CHUK alone received about 60% of medical students from the University of Rwanda, along with those from private universities. Professor Nyundo Martin, Clinical Director at the University Teaching Hospital of Kigali, highlights some of the challenges they faced, noting that the introduction of these new teaching hospitals will help address these issues.
Major challenge we have is about the capacity. The capacity in terms of facility and capacity in terms of trainers. So with those teaching hospitals, Level 2 teaching hospital, you understand that CHK and other teaching hospital will no longer suffer with this big number of students, and of course the quality of education will be high, will be improved.
Dr. Nyeshimana Menelas, head of the Department of Health Workforce Development at the Ministry of Health, explains that this initiative will accelerate progress towards the ministry's goal of quadrupling the health sector workforce within 4 years. The Ministry of Health also emphasizes that the expansion of hospitals across the country will increase the number of students able to secure internships, further supporting this objective.
Maybe to give an example what it means to activate the Level 2 teaching hospital in the education of gynecologists and obstetrics. As you know, in this country we still have a high rate of maternal and child-related mortality, and it has not changed over the last couple of years. And this country has around 110 obstetric gynecologists, and you can count how many women need those services. There are so many. And if you look at the classical teaching hospitals, Chuk, Chub, RMH, and King Faisal, they had the capacity to take 20. And these 20, if they start today, you will harvest them in 4 years. It means enrolling 20 in 2024 gives you 20 in 2028. By activating the Level 2 teaching hospital, we're able to take more than 60. We have the usual 20, and on each Level 2 teaching hospital, we add 4 residents, and we add faculty, we add equipment, we make sure the infrastructure is compatible, which means we have changed our trajectory. We are to have 20 in 2028, but we are going to harvest 60 in 2028.
Previously, hospitals providing teaching services for students had 1,907 beds, limiting the number of students who could participate in bedside teachings and delaying internships for many. However, the addition of Level 2 teaching hospitals has introduced 2,501 more beds, bringing the total to 4,408 beds. This expansion significantly increases the capacity to accommodate medical students, allowing more students to receive timely internships. Olive Nete, RTV News.
And that's all from us here at RB's Rwanda Television News. On behalf of the entire news production, as well as the technical team that made it happen, many thanks for being with us. And up until next time, stay safe, and we wish you a great and fruitful week ahead. Goodbye.